Welcome to Doctor's Housecall. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening and welcome to Doctor's House Call. Mike Farrell here with you, and in the studio with us, Dr. Gear and Dr. Wyrick, and a special guest today.
Yes, we do have a very special guest today, Mike, and all you listening out there in Radio Land. We have Billy here today. She's been on the show many times in the past and even called in from Phoenix. Today she's here in Payson with us, and she wants to share a lot of things that have gone on with her. And we would like her to just jump right in and tell everybody about all this stuff that's gone on with her in her life and how she got to this point where she's now changed her health pattern tremendously. Hi, Billy.
Well, hello, Dr. Gear. I think it's been about 14 years now that I've been saying, hello, Dr. Gear. And so I have quite a history here of being helped by Dr. Gear's manipulative surgery table, his spinal manipulations, and his advice regarding supplementation. And I started when I had a severe seizing of my back. My back just went absolutely, just froze up. I couldn't. And it was as a result of an emotional trauma following the death of my mother.
That was about 14, 15 years ago?
It was, at least. It was. My grandson's 16, and I think he was about 2 when I started with you. So I was seeing a doctor in your office at that time.
Yeah, that was a Norwegian American doctor with a naturopathic physician.
Yes. Yes, she was lovely, just lovely. She was doing a bioidentical hormones, and I found her and really liked her. She told me one day, she said, if you ever need a chiropractor, she pointed toward Dr. Gear's office. She said, he is the one. Well, at that time, I had never gone to a chiropractor. I didn't know what they did. But when my back froze up on me and I could not sit down, I couldn't lie down, I had no idea what was happening to me because I had never experienced that kind of pain before. So I called his office, I made the appointment. Dr. Gear started working on my back. And during the time that he was working on my back, I showed him my hands. My hands had large patches of psoriasis. And I had gone to 6 different dermatologists asking what is wrong with me. And I got all kinds of answers. No one really had a good one. I even went up to Tucson to the U of A and saw a doctor there who wrote a book on psoriasis and methotrexate.
That was U of A Medical School?
That's right.
Yeah.
That is right. He was supposed to be the top doctor.
Right.
And so I wanted an answer. My hands were horrible. So he put me on methotrexate for a year. Didn't do a bit of good.
No, wait. Dr. Wyrick, what does methotrexate do?
Methotrexate is used to suppress the immune system, and it is also used as a cancer chemotherapy unit. I consider it to be a very nasty drug.
And so this is what Billy was put on for a year.
Yes, it's often used when doctors think the immune system is overactive and they can't figure out how to calm it down.
So it's kind of a shotgun in that respect, but it's one with a bad backlash.
Well, it did my psoriasis absolutely no good. As a matter of fact, I met some women in a water aerobics class who had gone through methotrexate and Celebrex, all kinds of medications for their pain, and when the when the adverse effects began to destroy their stomach, their heart, their kidneys, they had weaned themselves off and had started doing all kinds of natural things to try to deal with their pain and have quality of life. When they told me about methotrexate and what it had done to them, I certainly weaned myself off of it, but there I was still, what do I do with this problem? So during the period of time when you were working on my back, Dr. Gear, I showed you the patches, and you said to me, you are not digesting protein. And so you started working on my back, and I asked you about, well, okay, what do I do regarding supplementation? And you said, don't take anything until I've worked on your back for a while. You have a twisted rib and other problems that are really making digestion a problem for you. I will tell you when to start using something. So after 6 months, you put me on Wobenzyme as a digestive enzyme, and then you put me on your manipulative surgery table. And that was really significant for a number of reasons, but one of them, you put me on, and I got off your table. It was really a shock, because that table is something to deal with. And so I got off the table. I didn't die, and I was really amazed at that. But I could breathe deeply for the first time in years.
You didn't know you couldn't breathe deeply before.
I knew I was huffing and puffing. I thought, well, maybe I'm getting old. Maybe that's something to expect. But when I could breathe deeply, I thought, whoa, man, this is wonderful. So, within 2 weeks of that treatment, my hands were perfect. No signs of psoriasis.
Let me pause you for a moment there, Billy. All the people listening, almost all of them, have heard many times me talk about the necessity of having good blood flow to the nerves between the vertebrae, especially in the mid-back, as far as the digestive juices are concerned, because those nerves go to the blood vessels of the organs of digestion. So if you don't have good blood flow to those nerves, you're not going to have good blood flow to the organs of digestion. And those organs work together with the vagus nerve, and the vagus nerve comes out of the skull right in front of the first vertebra. So if the skull and first vertebra are twisted, it affects the blood flow in the vagus nerve. So, Dr. Wyrick loves the vagus nerve. He goes all through the chest and the abdomen, and is the parasympathetic counter to all of the nerves coming out of the spine. So they have to work together. And if they're not, you're not going to work, your organs aren't going to work right. And all of that is regulated by the DNA molecule that tells those nerves when to work to make the blood vessels open and close in proper time sequence, so that the hormones and enzymes and other molecules of the body work in concert with each other. And when I use the term concert, I mean harmony, not this wild blast of sound that you hear when everything is screeching together, but in a harmonious, melodic manner. And that's how the body's chemistry should work. If it doesn't, you have disease. And your disease at that time was psoriasis.
It was, and it was caused, I was in that bad automobile accident, and you are still working on several things that resulted from that accident, and that accident occurred 50 years ago.
Yeah, that was when you were 20 years old?
I was almost 21.
Right.
Almost.
And it was so severe that you almost left the earth.
Well, I did. I was unconscious for a few days, and I woke up at Good Samaritan Hospital in ICU for quite a while.
And that accident happened over where those fires are right now.
Oh, really?
Yeah, around Superior and Globe, Miami area.
Yep.
Yeah. That's because somebody hit your vehicle head on, was it?
A young man who had just had a fight with his girlfriend was coming down a mountain and at full speed, and he came around a blind curve. and he was headed off the mountain, but I was there to catch him. So he didn't get so much as a bruise, but it certainly has made an effect on me. As a matter of fact, today you were working on my head, and I have a torque because my face went into the steering wheel, and so I have
50
a torque.
years ago.
Yeah.
Yeah.
And so today you were working on that.
Yes.
So you'll be working on that for as long as
we're both alive.
as we, right? And I've told you, if you decide to retire and go off somewhere, I will find you so that you can continue to work on those areas, and so that my head will work properly, and I can make good decisions and feel good, and my body work.
So that was part of the situation that got you up to where you had this psoriasis, and I was able to change your spine. And then also, because psoriasis is a genetic predisposition problem also, we have you on Wobenzyme to have you continue to digest your proteins better. You also took the IgG testing.
Oh, yes, I did. And as a matter of fact, that has been really wonderful because I've not had an upset stomach or anything since I found out what foods I'm not supposed to eat. And when I do indulge, and I occasionally, those foods slip in, I will have a little problem with my stomach. But I haven't had a problem in a long, long time.
You haven't had a severe problem since you were in Germany.
Well, that's very funny. That's true. But anyway, that kind of comes to this last 3 years, I've been battling anemia. And so there has been absolutely no one to find the reason for my anemia.
And this was a situation that first arose when Dr. Wyrick was asked to give you hormones, bioidentical hormones. And
well, yes, I was working with them, and he did not want to give me the hormones until I found out why I was bleeding.
Well, you had to have a lab test.
Yes.
And the lab test showed that you were anemic.
And I had, yes, and it also showed that I had iron deficiency anemia. It caused from an internal bleed.
Well, we found that out later.
Yes.
Yeah.
Well, it was actually on some of the paperwork from the lab work. That was one of those suggestions or whatever.
Right. It was a possible cause.
That's right.
Right. And then you had more tests done, didn't you?
I went through 3 colonoscopies, at least 2 endoscopies, a capsule study, all to try to find out why I was bleeding. And I started with a hematologist who gave me bags of iron. I think he's given me 4 bags.
When you say bags now, that's intravenous.
Yes, IVs.
Yeah, you sat there in the office for a while taking these IVs.
I did. And it would last for a while, but then I would lose that. So anyway, I had this ongoing problem. And one day I took my grandson to the golf course to hit balls, and afterwards I dropped him off. I was going home, and I became really, really tired. Really tired. I thought, I'm going home and going to bed. But there was just sort of an inner force inside of me that pushed me right from the exit to my house to the emergency room at John C. Lincoln. I went in and I said, look, I said, would you guys check my heart? My heart feels heavy, and I'm just really, really tired. I think I have a problem. And so they did. They checked me out. But 4 hours later, they put me in. They discovered I had a large hiatal hernia. My stomach was being pushed up into my esophageal area.
In your chest.
In my chest. And
above
that
your
push,
diaphragm.
every time I would eat, my stomach would activate. That would cause the stomach to get pushed up further, and that pushing caused an ulcer.
Well, what happened was when you ate, the acid would come up into your esophagus, and it would cause a reaction in the muscles of the esophagus, which would shorten, and they would pull your stomach up. So initially, the pushing of the stomach happened because of abdominal pressures, but then the stomach continuing going up, which eventually was a fairly large hiatal hernia, was because the esophagus kept contracting and pulling it up higher. So you started having this weird back and forth contractions of muscles in the esophageal stomach region, which made your stomach move back and forth through that hiatal hernia, that hiatus. What it's called is the sphincter, esophageal sphincter in the diaphragm, and that's what. Every time it got more irritated, then you would have a reaction of those diaphragm muscles, and it would tighten up on the stomach, so that you would have constriction, and then you would have all this sitting up in your chest, and it would put pressure in where your heart was. But nobody picked up until this last person that you're going to tell us about now did an endoscopy and found something.
Well, yes, he did. The workings of the stomach caused what is called a Cameron ulcer, and it was bleeding.
No, that's the Cameron ulcer. That's the folds of the stomach that make a fold. You know, and what do you call that in making cloth dresses and things? When you make a fold, it's a pleat, I think. Well, on the edge of that pleat, right on the crisp edge of that pleat, in your stomach, rugae, they're called, the folds of the stomach, it started to break apart. And that's where the capillaries in the stomach lining started to ooze blood into the stomach.
Whoa.
And that's why you had blood in your intestine and why you had anemia, because you were leaking it out faster than you were building it.
I certainly was. Yes,
and nobody
I was.
found that until this last gastroenterologist, young gastroenterologist doctor you told me, looked in there and he saw it happening.
He did. As a matter of fact, it was kind of, I had been going to a GI doctor for some time. He was the one doing the colonoscopies and the endoscopies. It was his partner that found it. And so...
sometimes a fresh look helps, doesn't it?
I guess so. Yeah, I guess so. So anyway, they told me that was what was going on, and the surgeon was. I tell you, I so appreciate a doctor who is just honest and just flat tells you what's wrong and what to do about it. He was not cruel by any means, but he told me I had two choices regarding this problem I had with my stomach. I could ignore it and just keep getting blood and die, or get the operation, and then that's the only way that they could stop the bleeding.
Right. You had
So
to get
I
rid of the
was
problem.
really quite shocked. I mean, how many times you hear a doctor say, you'll do this or you die? And so I decided I wanted to live. I still have plenty of things I want to do, places I want to go. And so I submitted to one of the most painful operations I've ever had. And I've had some beauties with, I woke up, what they do is blow you up with gas.
That's your abdomen.
Yes.
The abdomen, yeah.
But that gas gets throughout your body, and you talk about stiff joints, stiff muscles.
Well, you have to absorb the nitrogen into your bloodstream so that it reduces in your abdomen, and then that circulates throughout your body, and then that interferes with other chemistry in your body, and it takes time for you to come back to normal.
Well, I don't know if I'm still back to normal, but it certainly it
Well,
was
you're not
really
normal to
quite an
begin with.
experience. So they put 5 holes in my stomach, and they went in when it was robotically, and put a mesh thing in my stomach. Oh, I did all kinds of marvelous things. And so now I have some dietary restrictions now for the rest of my life, but it's great. It's fine. I'm living. And I had lost half of my blood, so they did so they gave me back a bunch of blood, and it made all the difference in the world. And that's when I really became aware of what anemia does to the body. For 3 years, I was not getting enough blood and oxygen to my brain, to my kidneys. I've become aware of all these organs that were really being hurt, and I was having all kinds of symptoms. And so this happened April 1st, April Fool's Day. And so here we are, 2 months or so, and I feel better than I have felt in years.
That's awesome. That's wonderful.
It is awesome.
Yep. It's kind of
Yeah. But I want to really put a warning out there to women who want to have a tummy tuck. I talked with a surgeon. I said, why do I have this problem? I have never, ever heard of a stomach being pushed up through a hole and getting into an area that doesn't belong. I've never heard of that before. And so what is this hiatal hernia? He says, well, most people, it comes mostly with obesity. Obese people have it. Well, I am not obese. I've never been obese. Also, it can come as a result of gastric distress. And during the study, I did not have any evidence of damage in the esophagus because of GERD. And so I thought, well, I wasn't surprised at that because I've done the diet. I've never had acid problems. And I don't know how many people I know who eat Tums every day, who use Prevacid every day to their detriment. We need acid. And when we have a problem, we've got to go find, why do we have the problem? Why is my stomach feeling like I have all this acid? I need acid. And so I thought...
Well, Billy, let me jump right in here.
Yes.
In people with too little acid in their stomach, they have the same symptoms as people with too much acid in their stomach. And so unless you do the testing to find out whether the stomach is producing normal or not normal amounts, it's not a good idea to take the antacids. And when you take the antacids, as Dr. Wyrick has pointed out many times, they're a short-term treatment. They're really the only real cure for those symptoms is what we did a long time ago with you, is the IgG testing to get rid of the foods and to get your spine straightened out, to get rid of the nerve irritation, and then the stomach works properly. Mm-hmm. When I did testing years and years ago, all my patients, I had a lot of GI patients back then when I did a general practice in Phoenix, and the patients with stomach problems, I would use a test on them that would show me what was going on with their acid. Out of every 10 patients, and I had hundreds of them, but out of every 10 patients, I would find one patient with normal acid, one patient with too much acid, and 8 patients with not enough acid.
Wow.
So the treatment wasn't really to give them acid, it was to get rid of the spinal problem so their stomach would produce normal amounts of acid, and then get them onto foods. Back in those days, we didn't have the IgG testing, so we did a rotation diet, we did a elimination diet, we did fasting, and then bring one food at a time back in. We did all kinds of things. Well, the IgG test is so much simpler, so fast, so easy to do, that it doesn't make any sense to do all those other things like we used to do years ago.
Right. Huh.
So.
Well, I tell you, I am grateful that I don't have an acid problem. But my problem came as a result of having had a tummy tuck. And it was too aggressive. And for years, I felt pressure. I was sort of stooped over. And
what do you mean by too aggressive?
it was too tight. And so I felt that for years, a discomfort. As a matter of fact, when you put me on that manipulative surgery table and you stretched my spine, you stretched that area also, and that's why I was able to breathe deeply. And so I asked the surgeon, I says, could it be that because I had the tummy tuck that was just flat too tight on me, and there was nothing I could do about that, could that have caused the pressure on my stomach to have started this problem? And he said it very well could have. So I remember that you and I met a young man. We were waiting in line for something, and he told me about his girlfriend was saving up her money for a tummy tuck. And you talked to her, at him, about doing something else, taking care of her health. And I tell you, I thought of that young woman so many times. When this is, it took 20 years for it to happen, but it happened, and it was very, very, very painful. And I just encourage women out there, if you've got problems, any kind of health problems, to really get to the cause of your problem and work it out in a healthy way. Dr. Gear has done wonders for me over the years. I'm walking because of him, and my health is, in spite of all the problems I've had, I feel fantastic. I'm 75 years old, and I'm playing with my great-grandbaby, and I'm getting another one. I'm looking forward to that. I'm just grateful, Dr. Gear.
And with the regular treatments that you're getting, you're able to play with your grandbaby and your great-grandbaby without any discomfort, hardly at all.
Well, that's not really true, because I have run to you up here several times, and had you put my back in place, you told me many times, don't pick up the baby, don't. Well, you can't not do that.
I know.
So I have several, you know very well.
I just treated another woman. I just treated another woman today who had picked up her great-grandbaby and had a stiff lower back.
Yes. You've treated me several times.
Yeah. And by the way, when you said you came up here from
Phoenix.
Phoenix, right.
Yeah. I have learned not to hesitate. As a matter of fact, was about 3 months, it was before this operation thing, I fell in the bathtub and fractured my shoulder, my right shoulder. Had a terrible time getting out of that tub, but I came right up here immediately. It was on a Sunday afternoon. I found you. You worked on that shoulder for 3 hours, and I went home. It was uncomfortable raising the arm up, but I was not in pain. And so the next day I called my primary care doctor. I wanted him to have a look at it, and I wanted it x-rayed to make sure that I was okay. It took a week to get that appointment, and then when I talked to him, he sent me to a orthopedic doctor. That took 2 weeks. So had I gone the normal route of waiting the next day to go to my doctor or try, it would have taken 3 weeks. What would my shoulder have been like in 3 weeks without treatment?
A lot of scar tissue would be building up already. Chronic pain during that period of time.
Oh, horrible pain during that time of,
I got you out of pain quickly.
Yes, you did.
That's that you can't wait when you get these kinds of injuries. You got to start working on it right away. And I did what was necessary to get you out of that acute phase so that your body could begin the healing process without impediment from spastic muscles and tissues that were really badly congested. So we did all that we had to do.
Yes, and not one pain pill, not one muscle relaxant, not 1 hour in rehabilitation of any sort. And my shoulder today is perfect.
Yeah, I just took care of 2 people this last Sunday, from Phoenix. They came up special for the treatment, and I was able to work with them. I see a lot of people like that on weekends, Sundays and Mondays, when I'm available. Yeah. That's because people are needing the treatment. They don't need to wait. I don't make people wait. I get them in right away.
Yes, you do.
Yeah. Making people wait is ridiculous because the body is going to continue its metabolism, going to continue doing what it's doing. And if you're sitting waiting, then you're going to get worse instead of better.
Mm-hmm.
Now you say, oh, well, it stopped hurting.
Ha.
Does that mean it got well?
No.
Not necessarily, because stopping hurting simply means the body found a detour around the construction zone.
Yeah.
Yeah. So, Billy, what else did you want to share with everybody?
Are you kidding? I've had so many things. And I'm just grateful that I can call you and find you. And you're always so willing to stop what you're doing and address these issues.
I just made it here to the show today because my receptionist said, oh, I need an adjustment, but I'll wait until tomorrow morning. What'd I do?
You took care of her right away.
I did, didn't I?
And she'll have a great night's sleep as a result of that.
And she'll be fresh and ready to take care of people tomorrow morning.
Yes, so it's benefited you, did it not?
Oh, absolutely benefited the patients as well as me. But
yeah, you'll have a happy employee tomorrow who's doing her job really. She does her job really well anyway, but she'll do it even better.
Right. Yeah, she was on the show last week.
Yes, she did a great job.
Yeah. She really does like what we do now.
Yeah.
It's been an eye-opener for her. And she's found out how much that other people find the benefits of first time, and some people as many times. I took care of another patient today, first time. He had been going to Dr. Bowman in Snowflake.
Oh, Dr. Bowman, we both love him, don't we?
Yes, we do. I go to him every week because he is really good quality adjusting. In fact, I was in another doctor's office yesterday, and his receptionist mentioned Dr. Bowman, that she loved him.
Yeah.
But that's that's an hour and a half, 45-minute drive each way.
Yes, but it's worth every bit of that time. And if anyone should see some of the maneuvers that he uses to get the job done, they'd probably be screaming because he is innovative, is he not?
He sure is. Does that remind you of somebody else here in Payson?
Yeah. But I've never seen you get up on a step stool and jump on anybody.
That's because I'm tall enough that I don't have to do that.
You jump anyway, and
I do.
You don't need a step stool.
I have been known to pounce.
Yes, you have. And I've been told that I have osteoporosis, and you've pounced on me so many times. I've wondered, how is it that I, with osteoporosis, leave your office feeling great when in reality being pounced on like that, I would expect some broken bones or something.
Well, I'm very, very, very careful in how I approach it.
Yes, you are.
And the only time that there's anybody who has pain afterwards is when I make a correction of malposition and put it back into better position. And then the body tells that person, oh, I've changed.
Yeah.
And you know what that's all about, don't you?
Oh,
Billy?
I do.
You felt those changes.
Yeah.
Other people all around have felt those changes as well.
But I really do appreciate, too, your instructions regarding ice.
Yes.
And ice is really a miracle tool.
Well, when ice was first, when I was first made aware of it, I was in medical school. That was 1960-ish. I graduated in 63. And the ice regimen that I used was taught to me because the Air Force Hospital for Spine Injuries in Texas in 1952, I was told, began using ice massage on these brand new injuries that they were seeing from the fighter pilots in the brand new jet aircraft. And they were being shot out with rocket seats because they couldn't climb out like they did in the P-40s and all those World War II propeller airplanes because the jets went too fast. And the tail would hit the person and kill them or break their bones or really smash them up because they couldn't get out of the airplane and get away from it before the tail would hit them. So they developed this seat with a rocket in it, shot him out, but they didn't support the head in any way in the beginning. And so it just tore up necks, gave him horrible whiplashes. And they found that the ice treatment was the very best treatment for that inflammation that was the initial inflammation. So I use it all the time with patients. We have special ice packs for the neck, special covers for those ice packs to hold them in place so a person can be mobile while they move around with the treatment. And ice 2 or 3 times a day makes a world of difference when we're initially breaking up all that congestion.
And why is it important to use the medical grade of ice pack as opposed to using something you use to freeze, use with frozen foods?
I mean, like peas and carrots in a bag?
Well, also the ice, the blue ice and all that.
Well, there's other types of ice that gets too cold, and then there's others that don't get cold enough.
Okay.
And there's others that don't stay cold long enough. So what we use has great BTU, British thermal units, and that is the amount of cold that they will transfer from their from the cold pack into the body, absorbing heat. It's technical, you know. Dr. Wyrick can explain it all in great detail. We don't need him to do that right now. But they work really good, and I've worn them many times driving from Payson to Phoenix when my own neck was sore.
Oh, yes.
And so it's the best treatment that you can do on your own at home, and it's a lot better than the pain medication. So anyway, that's our fast treatment for acute pain. Billy, you have gone through so much, and I've treated your children and your grandchildren, and you've seen changes in them as well.
I certainly did.
Yeah, you had a daughter who had an accident where she was riding her bicycle and had an altercation with a car, and she fell off and hit her head.
Yes, and you literally pulled her head from it. I don't know what it from, and you twisted it, put it back where it was, and she had double vision prior to your doing that. Her vision was perfect. She couldn't talk well. She had to sound like she had marbles in her mouth, and she started speaking correctly. So I saw that technique, and I thought, my gosh, what in the world are you doing to her? But it was exactly what she needed.
Well, it's a special technique that I learned when I was in school, and putting the skull back in proper relationship to the atlas allows then blood flow into the base of the brain, into the circle of Willis. That's the circle of blood vessels in the bottom of the brain, and you get full blood flow again. So a person's automatic muscle control begins to work, and lots of good things happen. In fact, there's a lot of athletes who have had this fantastic changes in their lives by getting good chiropractic care. But good chiropractic care is exactly what a person needs at the times they have the problem, and it should take care of the problem so that it corrects and constantly gets better and better and better and better, instead of going through the same process over and over and over again. Because you take drugs for that process. Mechanical problems need mechanical treatment. So we outlined a few things here about athletes, and but you've got a grandson who's becoming an athlete.
Hardly. I'm taking him in for golf lessons.
Right.
Yeah.
But he's very young yet.
Well, 15 and a half is
that's young.
Yeah.
He hasn't grown up with a golf club in his hands.
No, he hasn't. But he really likes it. But I'm trying to encourage him to get more involved with it. But he tends to like electronic devices. So it's a real challenge to get him pulled away from that into going out into the beautiful sunshine, the greens, and and hit golf balls and make friends. Yeah. With the COVID pandemic shutting everything down, his world became, sitting behind a computer. And so I was concerned about that, and I thought, but the only thing that was available was tennis or golf, and he certainly is not tennis material. So I found a pro and started golf lessons for him, and I'm hoping that he does something with it.
Yeah, we did some spinal treatment on him when he was younger, too, to correct some problems.
And he needs it again because when he really swings his golf club, his lower back hurts.
Well, you know where I'm at.
I know. Yep.
So, get a permission slip from his mother or his father and bring him up with you.
All right.
Dr. Wyrick, you've been pretty quiet this whole show. We have some testimonials here from some athletes. This. I know that you're not an athletic aficionado, but what is this fellow named Aaron Rodgers? What was he?
Well, he was a quarterback with the Green Bay Packers and a most valuable player in Super Bowl 45, if I read the Roman numerals correctly. And he said, "Performing at my best is important to me and should be for everyone. I am blessed that my dad is a chiropractor, getting adjusted regularly, along with practicing other good health habits that my mom helped to establish. All are part of my goal to win in life and on the field."
So this Aaron Rodgers, quarterback for the Green Bay Packers, father was a chiropractor and kept him in good shape through all of his upbringing to get into it. Now, there's another guy here who became a chiropractor. His name is Ben Weber, and he was a relief pitcher for Major League Baseball, various teams. And Dr. Wyrick, what was his testimonial?
I really like this story. He says, "Chiropractic care helped to prolong my baseball career and achieve the ultimate goal, a World Series win. Today, I am able to help others accomplish their dreams by practicing as a doctor of chiropractic." So when his career as a baseball player was over, he went back to school, learned to be a chiropractor, and now he helps others.
We had a radio show where we talked about a weightlifting champion of the Navy who did the same thing.
Yes, it's really great. I really admire people with second careers who choose the medical field.
And choose one that's so wonderfully efficient in making the whole person healthy. So there's a professional golfer. Billy, have you ever heard of Tommy Armour III?
No.
Well, his job is what he loves, and that's golf. You'd like to get your grandson to do the same thing.
I would love for him to fall in love with golf.
So he says, if I'm going to play the game well, I have to be healthy, and chiropractic plays a big role there. And we've got a patient right now who's been on the show several times, and he and his wife, that's Gene, and he has a disease of the brain called, what is it, Dr. Wyrick?
Parkinson's.
And he is doing golfing now, which he could not do prior to starting with the treatments at Payson Health and Wellness Center.
Yes, we are doing both spinal manipulation as well as treating him with some heavy-duty nutritional supplements.
That's proper biochemistry.
Yes.
Yes. And when you say nutritional supplements, but it's very precise, very directed, based upon your organic chemistry and biochemistry background.
I would like to mention that I watched Gene hit his golf balls at the tournament at our Payson golf course.
Yeah, you were there watching that.
I was. I as a matter of fact, I took a short video of him hitting his golf ball. I'm telling you, it was amazing. He's wonderful. his power of concentration. With Parkinson's, you really have to really have a good power of concentration and to do about anything, and he did. He was just wonderful.
Well,
it was
he had
privilege to watch.
Combination problem. He has Parkinson's, and he also had intention tremor. And that was because his neck was so badly damaged. And I'm pretty sure that's the reason he has Parkinson's, is because of the damage he had in his neck where his skull and his vertebrae meet. In fact, I've had, pointed this out to Dr. Wyrick, and I had Dr. Wyrick do some ultrasound on that area to break up the congestion. You remember that, Dr. Wyrick?
Oh, yes, and we continue to treat the area by various physical modalities.
Including some very strenuous manipulation.
Yes.
To keep breaking up the congestion there and keep moving toward a freer joint movement between the skull and first vertebra that will equate to better circulation in the spinal cord and brain. So it helps him to be healthier. Now, another person, a tight end for the Detroit Lions, named Tony Scheffler, said, chiropractic care helps to keep me healthy, and at the top of my game. Overall, my body feels and performs better because of the care I've received. And you don't have to be a professional athlete to appreciate the benefits of chiropractic. That's an important statement, You don't have to be a professional athlete. Any athlete, somebody goes out hiking in the forest is an athlete. Somebody who rides a horse is an athlete. Reminds me of a patient I took care of just recently who fell off a horse, landed up against a watering trough, and really jammed her back. Oh, what a terrible injury that was. But we got to it relatively quickly. But then she injured a second time, and we got to it right away that time because she didn't wait. She learned not to wait.
Right.
And that's important, isn't it, Billy?
It is very important right now. Yep.
So there's a fellow here is a head coach for the Parma Panthers, Andrew Papoccia, I guess, Papoccia. How do you pronounce that, Dr. Weiger?
Papoccia sounds
Papoccia.
Italian.
Okay. A good Italiano, yeah. So as a former competitive football player and now head coach of the Parma Panthers, 3-time Italian national Super Bowl champions, I truly stand behind the benefits of chiropractic care. It has helped me throughout my career as an athlete, and now I see it helping the team to achieve maximum athletic potential with faster recovery rates and increased protection from injuries. I highly recommend chiropractic care for anyone who is serious about his or her athletic performance and or health. Very important there, he said, protection from injuries. You know how that occurs? Because the body's working better.
Yes, having good muscle tone and the muscles that are well coordinated helps protect the spinal column by helping to keep it taut and properly aligned.
Now here's another person, Nancy Lieberman. She's a basketball Hall of Famer, 2-time Olympian, and she's a mom. And she said after a car accident in 1991, you get that, Billy, a car accident, she could not achieve good health until she finally went to a chiropractor, and the rest is history. For more than a decade, my chiropractor has allowed me to feel great and continue my career as a mom, businesswoman, and athlete. There's another professional golfer, Nota Bigay, 4-time PGA Tour champion. He states very simply, chiropractic care has been an instrumental component of my sports performance and preventive health strategy. And we go on and on with those, but I want to get on to something else here. How about something that occurs to so many people, constipation? Constipation and heart attacks. So the question is, will constipation cause your heart attack? Dr. Wyrick, what do you think about that?
Well, absolutely. Constipation does what is called create an increase in intrathecal pressure, that is the same thing that happens when an athlete does a Valsalva, and that puts pressure on the heart.
So 10% of sudden heart issues happen on the toilet. Sounds crazy, right?
Well, I don't know. There was a 4-year study of older men and women, and 11% of these events happened on the toilet. Oh, we have a caller.
Yes. Isn't that wonderful? So we have a caller. Hello, caller. You're on the air. How can we help you? Hello, caller.
Am I on?
Yes.
I just lost my grandma against dementia and Parkinson's disease.
I'm sorry to hear that.
She was 93.
Yes. How can we help you?
I was just letting everybody know that I lost my grandma.
Okay, well, that's very sad, and I'm sure that everyone here at the radio station and our listeners wish you the very best and have a thought or a prayer for your grandmother.
And she was 93 when she passed away.
Okay. Moving on.
You know, it's never been clearer that constipation is not a little problem. So if you're among the 63 million adults who spend more time on the toilet than they'd like to admit, what if I told you that all that paining and straining can end today? Without drugs, suppositories, fiber, fancy diets, or cleansers. Without straining, without bloating, without waiting. You sit, you go, you're empty. Billy, you've experienced some changes in your body's function, haven't you?
Yes, I've experienced several issues, yes.
And I have as well.
Well, that's normal, isn't it? Yes.
Well, not if it's every day, not if it's continuing. So we like to get rid of that. And one of the ways to get rid of it is to fix the spine so that the poop chute can work properly.
Okay.
You know the poop chute?
Yes, Dr. Gear, you've totally educated me on that.
Dr. Wyrick, who was that doctor that called it that and almost got kicked out of medical school?
Well, I'm not sure about that.
He was played by Robin Williams.
Oh,
he had a clown act. He put a red nose on.
Well, I know Robin Williams and the type of comedy that he used to do, starting with Good Morning Vietnam, but I don't recall when he was a doctor.
Well, he was a doctor in one of the movies that he did, and he was the doctor. I'll give it another caller. Maybe this person knows the answer. So, hello, caller. You're on the air. How can we help you?
Yes, Mrs. Doubtfire.
Hello?
Was it Mrs. Doubtfire?
Mrs. Deltmeyer was a doctor? No, I wouldn't think that a Mrs.
No, that was another show that Robin Williams played. He was a woman in that show, not a doctor.
Right, I'm thinking that was the name, Mrs. Doubtfire. Anyway.
Well, thank you for the suggestion.
So, I think his name was Cupsinell. Anyway, so the solution is to get your colon emptied before a cancer develops. And so what we do is we do the IgG testing to find out and fix your spine blockages to nerve function and losing the stinking thinking constant rehash. So you'd be very pleasant surprised with your results. Once you get rid of that inflammation in your intestinal tract, your intestines begin to work a whole lot better. You don't get all that straining and all that oomping when you're trying to get all that out of your system. So you take tiny changes. It takes less than 15 seconds to decide to change your life for the better. So come on, get off the couch, step up to the plate, hit a home run to return to your younger days of good body function. We have another caller. Hello, caller. You're on the air.
The name of the movie was Patch Adams.
Patch Adams.
That was it.
Very good.
All
Well,
right.
thank you.
You did good.
Okay. All right. I'll see you later. Bye.
So, here at Payson Health and Wellness, we're your coaching partners in this game of life. Take advantage of the Dr. Gear family and Dr. Wyrick's 100 years of chiropractic, naturopathic, homeopathic, osteopathic, acupuncture, physical therapeutic, and nutritional medical education and therapeutic experience. How's that for a mouthful, Billy?
Very good, Doctor. It is a mouthful.
So, Dr. Wyrick, people should call for their free 15-minute consult.
Yes, and our receptionist reminded me just before we went on the air today that we do have some openings for free 15-minute consults Friday and Saturday of this week. So give us a call. We're at Payson Health and Wellness Center. That's located at 801 East State Highway 260. That's right between the 260 Cafe and the American Legion, and just a little bit west of Culver's. The number to call us is 928-474-7409. And our receptionist, Sherry, is there to answer your call Tuesday through Saturday noon.
So I also want to let everybody know that we're getting ready to start a lecture series at Back to Basics Health Food Store here in Payson. Both Drs. Gear and Dr. Wyrick will be presenting various topics Wednesdays at 5:30 p.m. And it's going to be live, and you can ask us questions because we'll be there. And you put us on the spot if you want. Dr. Wyrick's pretty hard to put on the spot because he knows a lot about that chemistry stuff, all that nutritional stuff. So it's going to be limited to 10 people most likely, and you're going to have to do some pre-reservations. So if you call Back to Basics and tell them that you want to sign up for the talk for next week, Wednesday, it starts at 5:30 in the afternoon, and then on Thursday we're planning on doing the same thing at Payson Health and Wellness Center. It'll also be at 5:30. So you can give us a call and sign up. It's limited 10 people at both locations. We'll see what kind of interest you have in learning about all these various topics that we're going to be bringing up. So thank you all for listening. We really appreciate the ability to bring this kind of information to you every week. And we do hope that you've learned a lot. I know I've heard from a lot of people on how much they like the show and they listen to it every week. So, good Lord willing, the creek don't rise. We'll be back here next week.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.